Hi, I'm Dr Reynolds, one of the GPs at the Bell Surgery. You may have heard in the news recently about the government's zero tolerance campaign for healthcare staff, an idea that is strongly supported by the 4 GP surgeries in this local area: the Bell Surgery, Heart Surgery, Nettlebed Surgery and Sonning Common Health Centre. The policy basically states that GPs and their staff have a right to care for others without fear of being attacked or abused. Now, it's sad that we're having to highlight this idea, but recently the local surgeries have been experiencing an increase in abuse from our patients. We believe that in order to successfully provide good care to our patients, a mutual respect between the surgery staff and our patients has to be in place. At our surgeries, we work hard to hold up our end of this agreement. All of our staff are trained and aim to be helpful and sensitive to all patients' individual needs and circumstances. Our staff also fully understand that unwell or anxious patients can be under a lot of stress, and sometimes this might influence the way they act. In a similar way, we would like to remind our patients that very often our staff are dealing with a large number of varied requests and difficult tasks all at the same time, and therefore can be under a lot of pressure themselves. So, the important message that I want to share is, no matter how stressed or difficult a situation you may be facing, any form of aggression, abuse or violence towards our staff will not be tolerated. As well as the obvious examples of abuse, such as physical violence, I feel it is necessary to highlight other types of behaviour that are not acceptable, including using bad language or swearing at practice staff, any verbal abuse towards the staff in any form, including verbal insults, racial abuse or sexual harassment, obtaining medications or medical services fraudulently, and importantly, persistent or unrealistic demands that cause stress to our staff will also not be tolerated. We will do our best to meet our patients' requests where possible and will try to give explanations when we cannot. If we do experience or are made aware of any of these forms of abuse to our staff, we will take action by first sending a single warning letter to the abusive patient. If there is another incident, we retain the right to remove that patient from our practice list. Now, clearly, we are aware that the majority of our patients are very supportive and understanding in this difficult time, and I would like to take this opportunity to thank you all for your ongoing support. Thank you for listening.